Welcome to another Doctors Express Medical Minute.
Hi, I'm Dr. Joyce Moskowitz from Doctors Express, and I'm here to talk to you about the flu. We are entering the fall-winter season, which is the highest frequency of flu and upper respiratory illnesses. They are preventable, which is why we need to talk about it now. This is the time of year to get your flu vaccine. Adults can get the injectable. Children between 2 to 8 can get the nasal spray, the Fluzone. How do you know if you have the flu? Well, the flu and a cold or your garden variety upper respiratory illness can be very similar. However, with the flu, the fever starts abruptly. With a cold, it's more gradual. With the flu, the fever goes up to 104 degrees. With a cold, maybe up to 99.6 or 100. With the flu, it is very common to have body aches and joint aches, decreased appetite, and headache. Also, a dry cough. With the cold, you might experience all those symptoms, but not as commonly, and the prevalent symptoms are going to be the runny, stuffy nose, the sneezing, the sore throat, and the cough, a low-grade fever. We have treatment now for the flu. There are some oral medications that work against both influenza A and influenza B. The one most commonly used is Tamiflu, which is oseltamivir, and Relenza is the other. They can be used twice a day for 5 days to decrease the severity and decrease the duration of the flu symptoms. There also is prophylactic treatment, meaning you take it after you've been exposed because you don't want to get sick. Treatment available. The people that would benefit from that kind of treatment would be the people in the high-risk groups. So who is high risk for having complications from the flu? Women who are pregnant, people who are over 65, people who are younger than 5, people who have chronic diseases, heart disease, metabolic diseases like diabetes, asthma, pulmonary disease, liver disease, sickle cell disease, and any immunosuppressed individuals. And that doesn't mean only individual with AIDS, but it does mean people who are undergoing chemotherapy as well. What are the complications that we worry about with the flu? Ear infections, sinus infections, pneumonia, tracheobronchitis, which is basically croup. And we'd like to avoid all of those, and it's possible to avoid them. We'd like you to come to us or to your primary care doctor for evaluation if you have any symptoms, but hopefully before any symptoms develop, come in for the vaccine.
This has been another Medical Minute from Doctors Express Urgent Care, with locations in Danbury, West Hartford, Bridgeport, Stamford, and Hartsdale, New York.